Hello, my name is Samantha, and today I'll be presenting a One Health analysis of the Salmonella outbreak associated with Greenfield Farms. This case highlights the interconnected role of humans, animals, and environmental health in disease transmission. First, I would like to discuss an overview of the outbreak. In this case, a cluster of gastrointestinal illnesses was reported among the community, with 15 seeking care from the hospital, with a large majority of those seeking care from the hospital admitting to drinking the unpasteurized milk from the Greenfield farm. Laboratory testing was conducted of both a deceased chicken and a stream that contained runoff from the farm, and both of those were confirmed to have Salmonella enterica. The outbreak was linked to multiple sources, including the unpasteurized milk, the infected animals of both the cows and the chickens, and the contaminated stream that people in the community confirmed that they had used. There are several transmission pathways involved in this outbreak. First is the foodborne transmission that occurred through the consumption of the unpasteurized milk, specifically the cows that had the mastitis. And also possibly the contaminated poultry products, considering that the deceased chicken that they had tested on the farm did in fact test positive for salmonella. Secondly, environmental transmission played a major role. Manure runoff contaminated a nearby stream, which was used for irrigation by the farm and also recreational activities by the community. Finally, farm workers were exposed through direct contact with infected animals and waste, and thus could then transmit as well. Using a One Health framework, we can better understand how the health of humans, animals, and the environment are deeply interconnected. In this case, animals served as a reservoir for the salmonella, meaning they carried the bacteria. Humans were then exposed in multiple pathways, as mentioned, from contaminated food, direct or indirect contact with animals, and interactions with the surrounding environment, such as the stream. The environment itself played a critical role in transmission, acting as a bridge. For example, the contaminated stream likely facilitated the spread of that bacteria by allowing pathogens from animal sources to move through the water systems and reach people or food sources. This interconnected pathway highlights how disease transmission is rarely confined just to a single sector. In this case, it was multiple. Instead, it emerges from interactions between ecological systems, animal population, human behavior. By examining the outbreak through a One Health perspective, public health professionals can identify risks that might otherwise be overlooked, such as environmental contamination or animal reservoirs. Collaboration across fields like human medicine, veterinary science, and environmental health is essential to identify sources, infection, control transmission, and prevent future outbreaks. There are several stakeholders involved in this, and they're each involved and have their own role in managing the outbreak. Public health department typically lead the investigation by identifying cases, tracing the sources of exposure, and coordinating response efforts. Healthcare providers are responsible for in diagnosing and treating the affected patients, as well as reporting the cases that they do find to public health authorities. This is so that patterns and illnesses can be monitored. As for the farm owners and agricultural workers, they have an important responsibility to implement safety measures that reduce contamination risk, such as improving sanitation practices and properly managing animal waste. Veterinarians contribute by monitoring and managing animal health, helping identify potential reservoirs of infection among livestock or other animal. Environmental agencies play a role in monitoring the water quality and assessing environmental contamination, especially when natural resources like streams or irrigation systems may be involved in the disease transmission, as is in this case. Food safety authorities enforce regulations related to food production, processing, and distribution to prevent contaminated products from reaching consumers. Finally, you need the buy-in from the community members. All of this is great, but unless the community members are willing to comply or have the education to follow these practices, the implementation won't work. So you need their support to control the outbreak. To mitigate the current outbreak, several immediate actions are necessary to protect the public health and prevent further transmission. One of the first steps is issuing a public health advisory that warns people to avoid consuming raw milk and raw milk products since these can easily transmit harmful bacteria like Salmonella. People need to know about what's going on so that they can keep a lookout. Temporarily stopping the sale and distribution of raw milk from the affected source is also important to reduce the risk of additional exposure. At the farm level, infected or potentially infected animals should be isolated to prevent bacteria from spreading to other animals or contaminating animal products. Access to the contaminated stream that should be restricted, as environmental sources like water can act as pathways for ongoing transmission between animals, food sources, and humans. In addition, comprehensive testing is essential. This includes testing of the animals, the sampling from the water to assess contamination levels, and examining food products that may have been exposed. Together, these steps help identify the source of the outbreak, limit further spread, and guide effective control measures. For long-term prevention, a One Health approach is essential because it addresses the connection between human, animal, and environment. Preventing further outbreaks requires strategy that reduce contamination at multiple points within the system. One important step is properly treating animal manure before it is applied to land, since untreated manure can contain harmful pathogens that may contaminate soil, crops, or nearby water sources. Farms should also implement runoff control systems, such as barriers or drainage management, to prevent animal waste from entering streams, rivers, irrigation systems during rainfall. Enforcing pasteurization requirements is another critical measure, as pasteurization effectively kills harmful bacteria in milk and greatly reduces the risk of foodborne illnesses. In addition, routine veterinary screening can help identify infections in animals early, allowing farmers and veterinarians to take action before pathogens spread to humans. Environmental monitoring also plays a key role. Regular water quality testing can detect contamination in streams or other water sources before it leads to a widespread exposure. Finally, community education is an important component of prevention. Helping people understand safe food practices, the risk associated with raw dairy products, and how their behaviors can help reduce transmission is essential. At the system level, policy improvements are necessary to strengthen prevention and response efforts. This includes strengthening food safety regulations to ensure that food products are processed and distributed under conditions that minimize contamination risk. Improving agricultural waste management practices is also critical, particularly when it comes to safe handling and treating animal manure so that pathogens do not enter soil or water systems, as previously discussed. Another key component is enhancing collaboration across sectors, including public health, veterinary medicine, agriculture, and environmental agencies. When these sectors communicate and share information effectively, they can identify risks earlier and respond more quickly to potential outbreaks. In addition, developing an integrated surveillance system can greatly improve detection. By linking human health data with animal and environmental monitoring system, public health officials can identify patterns of disease earlier and implement prevention measures before outbreaks spread widely. The One Health approach offers several important benefits for managing and preventing disease outbreaks. First, it provides a more comprehensive understanding of how outbreaks occur by examining connections between human, animal, and environmental conditions. Instead of focusing on just one factor, the approach looks at the entire system in which diseases emerge and spread. By doing this, it helps identify and address the root cause of outbreaks, such as environmental contamination, animal reservoirs, or unsafe food practices. This makes prevention efforts more effective because the intervention can target the source of the problem rather than only responding to people after they have become sick. Another key benefit is improved coordination between sectors. Public health professionals, veterinarians, environmental scientists, and agriculture stakeholders can work together to share data, resources, and expertise. This collaboration strengthens surveillance, speed up response efforts, and reduces gaps in communication. Ultimately, the One Health approach supports more sustainable and long-term prevention strategies that protect the health of the people, animals, and ecosystems. As great as this all sounds, there's always challenges with everything. Coordination between these agencies, as previously discussed, can be complex, and each of them have their own interest. They may agree on a common goal, whether it's for this instance, it's the health of the public, but each of them have different motivations and different economic backing for those. So that may be hard to coordinate all of those ulterior motives. Additionally, resources may be limited. There may not be enough money to do all of the planning on the farm that needs to be done in order to prevent outbreaks like this. Overall, this case demonstrated that human, animal, and environmental health are deeply interconnected, and effective prevention requires collaboration across all three domains.